So next we have Michelle Massey Barnes from the Advocates for Mental Health of Michigan Youth. And there will be, I understand, a number of people on Zoom as well who are interested in testifying. So if Michelle, if you can kind of lead us through who's here with us today.
Thank you so much for having me. My name is Michelle Massey Barnes. I live in Jackson County, and I am a co-director and co-founder of Advocates for Mental Health of My Youth. We are a grassroots parent advocacy group. We've come together because we have children with what Michigan calls severe emotional disturbance, or SED for short. There's a special Medicaid waiver for children with SED. It's called the SED waiver. And it's a waiver that means without intensive home and community supports, these children would be hospitalized or institutionalized. It's not what any of our families want, but it is what most of the families that you will hear from today are experiencing with their children. I'm explaining this to you because we're not coming to you as parents with children with low or moderate mental health needs. We are parents with children with the most intensive needs in the state of Michigan. We have a lot in common, but one thing that we have in common is that the community mental health services that we are receiving, they're not helping our children. Sometimes the services are actually making things worse for our families, and they're causing us more distress. I knew that I was going to need help navigating the public mental health system when we first entered it. I knew I was going to need allies, support, and even backup, because sometimes it honestly feels like the system is working against us. The more my family advocated for the help and support that we needed, the more our services were getting cut. Mobile crisis units started to refuse to respond to our calls, and we were singled out and told that our child had to have a specific assessment done by a nurse, even though this was not a policy of our CMH. I don't know what most people call that, but I call it discrimination. It was impossible to navigate this system alone. If you would like specific examples of what makes it so impossible, please feel free to reach out to me. I'd love to have coffee with you or Zoom coffee and tell you about the 3.5-month CPS investigation that we went through because of what community mental health was falsely reporting to Child Protective Services. At the end of the investigation, nothing was substantiated, but the CPS investigator told me the best advice she had for us was to leave community mental health because CMH was more interested in fighting with me, the hands-on mom, than helping my child. Our grassroots parent advocacy group hit the ground running. We spoke at the Appropriations Subcommittee meeting last year, and you will probably hear from many of us again today. And I think you will realize that nothing has changed except for our advocacy. In the last 2 weeks alone, we have helped 24 families connect with their state representatives, 20 different state representatives. Some of you are even on this committee, and thank you to those of you who have already stepped in to help. We have over 500 parents in a private Facebook group, and the truth is we cannot keep up with the stories. We can't keep up with the crisis. We can't keep up with the desperate pleas for help. What we need you to understand is even though you've heard from 24 of us, there's so many of us that you haven't heard from. You're not hearing from families that don't have discretionary income for internet access or mobile devices. You're not hearing from families that have English as a second language or families that are working so hard to make ends meet that they're working instead of surfing Facebook looking for secret advocacy groups that most people don't even know exist. So we're coming to you today because one of our asks is for a mental health navigator program that will help all families get the support that they need and will put their experiences front and center. We need navigators that understand how the mental health system is actually working and not navigators that assume that the system is working the way that it should be working. There's a huge difference. We need this program to ensure that our complaints are being investigated and corrected. Most of all, we need parent voices included in the role of oversight and accountability, because the truth is, if the distress levels of families are not decreasing, the complaints have not been adequately resolved. We believe the Mental Health Navigator program can fill both of these roles. We know this is something that MHAM has asked for, general fund dollars in the amount of $2 million for a child and youth navigator or advocacy service. We have a working model as advocates for mental health of my youth, and we would like to be collaborative partners backing this request for funding and backing the development of the program. Thank you so much.
Thank you, Michelle. Do we have any families on Zoom that wanted to give their testimony?
So there's a couple of us in the crowd,
Okay.
and then there might be a couple people on Zoom, but the people in the crowd are co-founders, so it'd be great if we could go first.
Okay, go right ahead. And please introduce yourself and your organization.
I just turned it off. Thank you. My name is Rachel Kusheri Murray, and I'm with the Advocates of Mental Health for My Youth. And I'm a co-founder and director, and also a resident of Eaton County. My son has a waiver into Medicaid for severe emotional disturbance. The hardest decision I ever had to make in my whole life was to send my child out of state to receive the mental health treatment that he needed. And the second hardest decision I ever had to make was to go into debt over $250,000 to pay for it. My family has seen how this mental health system functions as it is, and I want to help you to understand what our families are dealing with. Children like mine and the families that you're going to hear from today make contact with the state of Michigan through the schools, CMH, child welfare, and juvenile justice. And with access points, you might think that it'd be easy to get help, but it is actually the opposite, and the stakes are high, because when families like mine don't get the help that we need, we're at high risk for losing our children to the courts and to foster care. And things go wrong a lot for families like mine. That's why our foster care system and our juvenile justice system is bursting at the seams right now. So you may not have known that this was happening if you're only talking to the department heads, but in the last year, we've connected with over 500 families living in crisis every day, and the stories are strikingly similar. Everyone's fighting to keep their kids and families safe while trying to avoid abandoning their children to foster care or jail. So I invite you all to follow our group on Facebook at Mental Health for My Youth, so that you can see the stories for yourself. It's true that the dismantling of the mental health system in the 90s and the constant defunding of all of these departments have contributed to this situation. And we're starting to see the funding increase for individuals with low and moderate mental health needs. And we appreciate that, and we fully support and encourage it, because prevention is always the least expensive option. But we still have a whole population of children and adults with severe and complex mental health needs that are languishing. It's not enough to wait weeks or months to see if a crisis will resolve itself and then barely stabilize a child before sending them home with no support. That's what's happening now. And it's putting lives at risk all across Michigan. So instead, Michigan needs to properly fund mental health programs that are meaningful. We need to attract specialized talent to the state and provide intensive and ongoing training to build the expert knowledge base within our state. We must open cutting-edge treatment facilities that are more than just beds or numbers of beds, but provide critical, specialized therapeutic care that is holistic and suited to condition. That's what exists in other states. It doesn't exist in Michigan now. And we must fund that treatment to be completed so that it can prevent and reduce reoccurrence. And other departments need to be involved in this too, with the funding for mental health. So we need to properly fund juvenile justice so that children who are pushed into our justice system get the proper treatment suited to their condition while they're incarcerated. That's not happening now. And we also need to fund cooperation and coordination between the departments so that services can be seamless with proper transition plans when children move between departments. So like technology like OPICA could help with that. And lastly, something that doesn't cost anything is we need strong insurance parity laws so that insurance companies can't weasel out of paying for treatment that is medically necessary and covered under the plan, like what happened to my family with Anthem Blue Cross Blue Shield. It's been decades since the dismantling started, and it has been ongoing. Michigan has some of the worst statistics in the nation regarding mental health care, but you all can change that. You can make us a leader in the nation. Please hear the voices of family who know this whole system better than any expert within one department could. We are here to help you. When I made the decision to send my child out of state for his mental health treatment, people accused me of wanting him away from me. Nobody would have said that same thing if I had sent him for edge cancer treatment. He's back home now and he's doing so much better. He's improving every day, but my family shouldn't have had to have gone through that. Families who cannot access debt shouldn't have to send their kids to jail or a foster home instead of treatment. Those children deserve to be well too. So let's build a system that we can all be proud of. Thank you.
Thanks, Rachel. Is this on? I see the red light. Okay.
Next, we have Meghann Gunnarsson.
Oh, thank you. My name is Meghann Gunnarsson. I am a resident of Washtenaw County and the mother of 4. I initially came on to read the story from another parent who was unable to participate today due to working, but also wanted to share my story. I have a child who had 14 admissions in 14 months for severe suicidal ideation and attempt. Each time she was released back to the community too soon. Of those 14 hospitalizations, 3 of them were placed out of state in short-term residential care. Each time she was released prior to completing the program due to insurance. We were placed on the CMH waiver during her last admission because her community-based psychiatrist and her community-based psychologist both dropped her from their practice because her medical liability was too high. We were promised wraparound services and family support, neither of which were obtained due to short staffing issues. Our child currently is out of the hospital, but not well. We have not been part of the juvenile justice system, thankfully, but I don't rule it out given the stories that I hear in the community and the suggestions that have been given to us by medical staff. Brought her home at times, I'm sorry, because it was either bring her home or they would release her to a homeless shelter. Our other children have been very damaged by this merry-go-round system. And I ask you to please better fund community health as well as hold the insurance companies responsible for releasing children prior to wellness due to dollar signs. And